So today we're going to be teaching about hands-only CPR and how to do hands-only CPR, and also how to use an AED, or automated external defibrillator. The first things I want to teach you here today is what to do when you see somebody and you find somebody unresponsive on the ground. First of all, we used to feel for pulse checks, but we found that has taken too much time off of actually getting good quality compression, so now we just look for effective breathing. If they're not breathing or their breathing is not effective breathing, an example would be agonal respirations, and they kind of look like this. And they're kind of gasping for air, but really they're not getting any air in. That means they're in cardiac arrest and they need chest compressions. So first thing you do then, once you realize that they're not breathing or they're having ineffective respirations, is find the center of the chest, go right between the nipple line and take the heel of your palm and set it right down in that center of the chest. I like to clasp my other hand in between my fingers like this and anchor my fingers right here. We're going to do at least 100 compressions a minute. We like now to do between 100 and 120 a minute. Now I'll push down at least 2 inches on an adult. So you go down and make sure you come all the way off. Down and all the way off. And you're going to just keep pumping on the chest for 2 minutes until somebody else can come and take over for you.
All right, so today we're also going to talk about the use of an AED. There's a couple different styles you'll see, but they're coming out more and more. We'll see them in schools, at the grocery store, department stores, any kind of public building where they're trying to get more and more use or be out in the open more. Ideally with an AED, you want to let a bystander grab it for you, or if you can grab it before you start. Ultimately, we never want to stop compressions until that person starts responding or EMS gets there and they relieve you. We want to turn it on and it'll start talking to us. It'll prompt us to go ahead and put our pads on the patient. Pads are marked. One is shown right here to put up on their upper right chest. The other one is shown on their left side here. What this does then is the AED will read the heart rhythm, and if it feels it's necessary, it'll advise you to shock. And when it shocks the patient, what it's trying to do is come right through here. Your heart sits right about here in your chest to shock your heart and try to get the electrical current in the heart reset and act as it's supposed to.
Plug in training pads connector.
It's telling me to plug in the pads. Every AED
Connector
should have the
inserted.
set of
Training.
pads like this.
Press the flashing blue button to choose training scenario 2. Remove clothes from patient's chest.
Okay. So ideally when we do CPR, we already took their shirt off.
Peel
If not,
white pads
it's telling
from
me
gray
to.
plastic case.
And now it's telling
Attach
me
pads to bare skin exactly as shown.
Put our
Stay
pads on.
clear of patient.
it's telling me. So if we're doing
Analyzing heart
compressions,
rhythm.
we want to stop at this time.
Stay clear of patient. Analyzing heart rhythm. Shock advised. Analyzing heart rhythm. Shock advised. Stay clear
Again,
of
we're gonna
patient.
follow its
Press the
prompts, make
flashing
sure
orange
everybody's
button
clear.
Now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR.
All right, so then we would
For
follow
help
its
with
prompt,
CPR,
and we would
press
want to continue
the
our
flashing
compressions.
blue button.
After you continue compressions, the AED would continue to analyze. At some point, it would tell you to stop so that it can analyze the heart rhythm. Again, just keep following the prompts. That's the great things with the AEDs like this, is that
1 minute,
it'll assist
45
you through the
seconds
whole
until
process.
analysis.